My research really is about understanding HIV and understanding sexual behaviour related to HIV. So understanding why people engage in risky behaviour, what kind of behaviours might put them at risk of contracting HIV, and also working with governments and with charities to help them design more effective HIV prevention campaigns, and then kind of evaluating them to see how good they are and how they might be improved in the future. Most of my work is among people who are most at risk. So HIV can affect anyone, but there are certain sections of the population who are most likely to get it. And certainly here in the UK or in Western Europe, that's men who have sex with men, so primarily gay or bisexual men, and also black African people, so people who've migrated here, usually from sub-Saharan Africa. They're much more likely to catch HIV or have HIV than the rest of the population. So it's really important we focus our attention on understanding what their needs are and how we can prevent them in the future contracting it. So I might travel around the country conducting interviews with gay men or with black African people, understanding a bit about who they are, the kind of lives they lead, the kind of sex they have, the kind of sex they want to have, and what kind of good sex would look like if they were able to achieve that. I also do a lot of survey work, so I work with lots of different charities, both here and abroad, helping them to devise questionnaires that they can give to these most at-risk populations, try and understand, like I said, the kind of sex they have, if they're using condoms, if they know where they can get a HIV test, if they are HIV positive, and if they're taking their medications appropriately, a whole range of those kinds of questions. So those are it's a bit of a mixture of the things I do. I think people don't always recognise that, if I use gay men as an example, not only are they more likely to contract HIV, they're more likely as a population to have HIV, it's also much harder for them to access medication, it's much harder for them to go and to get a HIV test. They don't often feel comfortable in healthcare settings talking about the kinds of sex they have. They're often not welcome in healthcare settings. A project we did in the Caribbean recently among gay men living in the Caribbean, and lots of them said that when I went to go and talk about the sex that I was having, no one wanted to talk to me about it. They didn't want to know. So despite the fact that they're really at risk, there's a very good chance they could catch it. There was no advice that they could get. They had trouble accessing services to help them. I think a lot of the general public doesn't recognise that. They aren't aware that these are big disparities in not only how susceptible we are to illness, but how easy it is for different groups to go and access healthcare when they need it. And I think that's also true in this country for many black African people who don't feel comfortable going to healthcare services. They don't often speak the same language as the nurses and doctors who are caring for them. It's very difficult for them to articulate their feelings and their worries and their concerns. And I think sometimes Joe Public walking past the window might not understand how hard it can be for people who are in sections, who come from sections of the community that are quite marginalised. I think the future is mixed. I think we've made some great leaps forward in HIV prevention and treatment over the years. It's now, you can now live for the long term in a healthy way with diagnosed HIV, as long as you have access to medication and you take that medication on a regular basis. There's every reason to think you'll live as long as someone who doesn't have HIV. That's brilliant. The problem is that the people who most need that don't often receive it. So in many parts of the world, they still don't have access to that kind of medication. So life expectancy for someone with HIV in many sub-Saharan African countries would be decades lower than it would be for someone living here. That's still a problem. I think there are particular problems again relating to gay men in that although there have been big social changes in that homosexuality is much more accepted certainly here in the UK and in many other parts of Western Europe, and is becoming more acceptable in North America, although, you know, gay marriage and the like still is illegal there. In many other parts of the world, things are actually getting worse. So in Uganda, we're seeing the establishment of new laws that might convey the death penalty if you're found to have sex with another man. It's making it much, much harder for the kinds of organisations I work with to try and access, define, to talk to those men. And talk to them about their sexual health, talk to them about HIV, to make sure that they're doing things to prevent themselves from becoming infected or from transmitting it in the future. So I think the picture is complicated as to how we're going forward. I think it's feeling like you're making a difference. I love my job, I genuinely do. There's never been a day where I haven't wanted to come to work. I get to sit down with people and talk through some very sensitive and emotional aspects of their lives sometimes, and I feel very privileged that they feel able to tell me things about themselves, about having HIV or living with someone who has HIV, for example. And I feel privileged that they can share that with me openly. And I can then use that information that I collect from lots of different individuals, and I can talk to charities or to governments, and I can say, look, these are the kinds of things we can do to improve the situation for these people who are most at risk. And then, you know, every now and again I see a new poster or a new campaign or a new service that's being delivered by one of these charities, and it's based on the research that I and my colleagues have done. And that's a really lovely feeling when you think, you know, that came from something we did. That's really nice. I don't think I'm alone in enjoying coming to work, not just here, but in the kind of field of health inequalities research that I do. Everyone comes into it, not for the money or for the fame or fortune, but because you care about making a difference. You are passionate about trying to improve the health and well-being of those people who are most vulnerable and those people who can't necessarily speak for themselves. It's a great way to get out of bed in the morning. Although it can be hard, it can be tough, it can be challenging, there's often lots of politics that you have to navigate, and it can be very emotional talking to people who are in very deprived or vulnerable situations, but it's also very rewarding when you can see that translated into kind of real action in the long term.